A comprehensive systematic review and meta-analysis conducted by researchers from institutions across China and the United States has revealed compelling evidence supporting vitamin D supplementation as a powerful tool for improving cardiometabolic health. Published in the journal Engineering, this extensive study synthesized data from 99 randomized controlled trials involving 17,656 participants, highlighting vitamin D's potential in mitigating cardiovascular and metabolic risks. These findings could influence future public health strategies and drive the development of personalized therapeutic interventions targeting cardiovascular diseases. The analysis focused on the effects of vitamin D supplementation, with a median daily dose of 3,320 international units (IU) on various cardiometabolic risk factors. The results were significant, revealing reductions in systolic and diastolic blood pressure, total cholesterol, fasting blood glucose, hemoglobin A1C, and fasting insulin levels, key markers linked to cardiovascular and metabolic conditions. Elevated blood pressure, a major risk factor for heart attacks, strokes, and other cardiovascular diseases, showed notable improvement with vitamin D supplementation. The reduction in both systolic and diastolic pressure highlights vitamin D's potential as an adjunct in managing hypertension, which is prevalent in populations with poor cardiovascular health. The study also demonstrated a reduction in total cholesterol levels. High cholesterol is closely associated with an increased risk of atherosclerosis, where plaque builds up inside the arteries, leading to heart disease and stroke. By lowering cholesterol, vitamin D may help reduce this risk, offering a protective effect against cardiovascular complications. The analysis further showed improvements in fasting blood glucose and hemoglobin A1C levels, which are critical indicators of blood sugar control and insulin resistance. Poor control of these markers is directly linked to the development of type 2 diabetes, a condition that significantly elevates cardiovascular risk. The reduction in fasting insulin levels observed in the study suggests that vitamin D might enhance insulin sensitivity, which could be beneficial in preventing and managing diabetes. One of the most striking aspects of the study was its identification of specific populations that experienced the most pronounced benefits from vitamin D supplementation. The data showed that non-Western populations, individuals with low baseline vitamin D levels, older adults, and those with a lower body mass index, BMI, saw the greatest improvements in cardiometabolic markers. Non-Western populations experienced greater benefits from vitamin D supplementation compared to Western populations. This difference could be attributed to lower baseline levels of vitamin D commonly found in non-Western groups, often due to factors such as less sun exposure, dietary habits, and genetic differences in vitamin D metabolism. These findings suggest that vitamin D supplementation could be particularly impactful in regions where deficiency is prevalent, offering a potentially cost-effective intervention to reduce cardiovascular risk. Individuals with baseline 25-hydroxyvitamin D levels below 15 nanograms per milliliter, which indicates a deficiency, showed the greatest improvements in cardiometabolic outcomes. Addressing vitamin D deficiency in this group is crucial, as low levels of the vitamin have been linked to a higher risk of hypertension, diabetes, and other metabolic disorders. The findings support the importance of screening for and correcting vitamin D deficiency, particularly in those at risk for cardiometabolic diseases. Older adults, particularly those aged 50 and above, also saw significant benefits. Aging is associated with a decline in the skin's ability to synthesize vitamin D, along with dietary and lifestyle factors that often lead to deficiency. As a result, older individuals are at higher risk for conditions like osteoporosis, hypertension, and cardiovascular diseases. The study's findings suggest that vitamin D supplementation could be a key intervention to improve health outcomes in this age group, potentially reducing the burden of age-related cardiometabolic conditions. Participants with a BMI below 30, those not classified as obese, also benefited more from vitamin D supplementation compared to their obese counterparts. This may be due to differences in how vitamin D is stored and metabolized in the body. In obese individuals, vitamin D can be sequestered in fat tissue, making it less bioavailable. These findings indicate that body composition plays a role in how effectively vitamin D can exert its beneficial effects, highlighting the need for tailored dosing strategies based on individual body weight. The study underscores the importance of a personalized approach to vitamin D supplementation, moving away from a generalized strategy toward one that considers individual factors such as age, baseline vitamin D levels, BMI, and ethnocultural background. This personalized approach could enhance the effectiveness of interventions aimed at reducing the prevalence of cardiometabolic diseases, which remain a leading cause of morbidity and mortality worldwide. Personalized vitamin D supplementation strategies could help target those most at risk and deliver the greatest benefit. For example, individuals with low baseline levels might require higher doses of vitamin D to achieve optimal health outcomes, while those with adequate levels might need only minimal supplementation. Furthermore, considering factors such as BMI and dietary habits could refine these strategies even further, ensuring that the right dose is delivered to the right person. The findings also suggest that duration plays a critical role in the efficacy of vitamin D supplementation. Longer interventions of 3 months or more were associated with more significant improvements in cardiometabolic markers, emphasizing the need for sustained supplementation to achieve meaningful health benefits. Short-term supplementation may not provide sufficient time for vitamin D to exert its full effects, particularly in populations with severe deficiencies or complex health conditions. While the study provides robust evidence for the benefits of vitamin D supplementation, the study emphasized the need for further research to explore the mechanisms behind these effects. Understanding how vitamin D interacts with other biological pathways, including its influence on inflammation, hormone regulation, and gene expression, could provide deeper insights into its role in cardiometabolic health. Additionally, the study highlights the need to explore the long-term effects and potential risks associated with high-dose vitamin D supplementation. Although the analysis supports the use of higher doses in certain populations, excessive intake of vitamin D can lead to hypercalcemia and other complications. Balancing the benefits and risks of supplementation will be critical in developing safe and effective public health guidelines. Future research should also investigate the potential benefits of vitamin D on other chronic conditions linked to cardiometabolic health, such as obesity, metabolic syndrome, and chronic kidney disease. Expanding the scope of research could further elucidate the broad-reaching effects of vitamin D and help refine its use as a therapeutic intervention. As cardiovascular diseases continue to be a leading cause of death globally, the findings of this study offer new hope for more effective and targeted preventive strategies. By integrating personalized vitamin D supplementation into broader public health initiatives, healthcare providers could significantly reduce the prevalence of cardiometabolic diseases, improve quality of life, and lessen the burden on healthcare systems. This research not only strengthens the evidence base for vitamin D's role in health, but also highlights the transformative potential of personalized medicine in optimizing treatment efficacy. As our understanding of vitamin D's impact on cardiometabolic health continues to grow, these findings could pave the way for more nuanced, individualized approaches in the fight against cardiovascular and metabolic diseases. These findings highlight the powerful impact of vitamin D on cardiometabolic health and underscore the importance of personalized supplementation strategies. By tailoring vitamin D intake based on individual characteristics like age, baseline levels, and body composition, we can significantly enhance intervention outcomes and pave the way for more effective preventive healthcare strategies. As cardiovascular diseases continue to pose a major global health challenge, this study provides hope for a future where targeted, evidence-based approaches can help reduce risks and improve lives. If you found this information helpful, don't forget to like, subscribe, and hit the notification bell so you never miss out on the latest updates in health and wellness. Let's keep learning and working towards a healthier, more informed future together. Thanks for watching, and see you in the next video.